Today I want to talk about what is integrative oncology, or more specifically, what is integrative cancer care. To dive into an exploration of this topic, I think we have to understand the words, integration or integrative. And to do so, it brings together my love for the origin of words, what's called etymology. And so when we look at the study of the historical context of words, that's really what the study of etymology is. It's looking at words and their birth out of history, because without understanding the context of history, it's really hard to understand the meaning of the words that are born out of it. So when you look at etymology, it's the study of that origin of words in the context of history. So looking at the word integration or integrative, really its original word is from the Latin integrationem, which what that means is to restore the whole, to renew. So if you want to look at what it means to practice integrative cancer care or integrative oncology, we have to look at the context of that word and say it's to restore the whole or to renew. Now, we also have to look at the cancer part of that. And as it relates to medicine, remember the word physician in Hebrew is raphae. And what that means is healer. So when we put these two in context together, what we have is we have a integrative healer, or a healer that's working to restore the whole and renew the body. That's what it means to be an integrative cancer doctor working in integrative cancer care or integrative oncology. So when we do integrative cancer care, we're integrating at several different levels. The first is the integration of that historical context of the word. We cannot lose sight of that. If we lose sight of that historical original context, we lose the meaning. We lose the purpose of that word. And you see that in so much in culture today. There's a historical loss of context of the word to its meaning historically. And thus the word gets reworded, it gets redefined. So we want to hold true to that original origin here of these words. Second, what we want to do is we want to really understand the historical, it's going to be the integrative concept of many different aspects of medicine. So the second part here would be the integration of the spirit, the body, with the mind. Now, as it relates to the spirit, healing begins above. And it comes through the body, through the physical. And so when we look at that, ignoring that spiritual component to healing, which Raphae, physician, means healer, we're losing the origin of that healing process. The second is the mind, more the emotions. When you look at this, the perfect context here is stress. So much of many diseases are born out of this stress, whether it be acute, whether it be chronic. And this stress can be the preliminary trigger that forms cancer, that forms disease. It helps to lay the environment out of which disease develops, or it can actually be a hindrance to the process of healing. But all of these, the spiritual, the healing from above, through the emotions, through the mind, helps us to achieve that physical healing, because that's what we want. But in actuality, that's the end point. It's that physical healing, but we have to address all of those to achieve that. The third level of integration here is the targeting of the tumor, as well as the targeting of healing the body. Again, integrative is restoring the whole. So we can't just target the tumor, target the cancer, and forget about the whole that is the context of the body. Cancer is not the whole of the body, it's just a part. So we have to create a dual objectives of targeting the tumor and healing the body. Most of what happens today in the care for cancer patients, it's targeting the tumor at the expense of the body. The perfect example here is the immune system. Destroy the immune system on the way to healing the body by eradicating the tumor makes no sense. And that in turn is how cancer can recur, and actually the evidence shows how cancer spreads. So we have to take this dual context and say, you know what, we need to target this tumor, but at the same time, our ultimate goal is to heal the body. And so we have to integrate these together. The next level of integration is the integration of therapies. And most people look at this in the context of integration of maybe nutrition with supplements, but this can be integration of nutrition with holistic natural IV therapies. It could be integration of different IV therapies together. It can be integration of IV vitamin C or IV curcumin with laser photodynamic therapy. It can be integration of supplements targeted with repurposed medications. The integration can be widespread in how that process works together. But the whole objective, the whole goal there is to target the tumor and heal the body. And we objectively and we integrate these therapies to do so. The next level of integration is an interesting one, and one I could spend hours talking about. It's the actual integration of allopathic medicine and holistic medicine. It's this integration. Now, it's really interesting when you look at the word of allopathic medicine. It comes from the word allopathy, which is originally from Latin. Now, also that word really seems to come out of the word allopathy, which originates from the father of homeopathy, Samuel Hahnemann. Now, that's interesting because allopathic medicine today, which is conventional, is a standard for conventional cancer care, is born out of allopathy, which is from the father of homeopathy, Samuel Hahnemann. Now, those two, allopathy and homeopathy, couldn't be more paradoxical in nature. Yet, one, allopathic medicine, is born out of homeopathy. What it really shows you here is the context of how far medicine from its origin has strayed. Because we need to integrate the collection of these therapies, allopathic and holistic, together. That is what allows us to get this integrative approach to cancer care. And this concept, it's the healing, it's the restoring of the whole. We can't lose sight of the origin, homeopathy, but we also have to understand the value that allopathic therapies today can provide through science and through knowledge. And bringing these together, that's what gives us integrative cancer care that promotes healing and restoration of the whole. The next level of integration is integration with the body. Now there's a novel concept. Let's work with the body rather than against it. The perfect example that we see in how conventional medicine approaches cancer care today, it really involves the process of ignoring this process of working with the body. It's solely focused on the tumor. Now, rightly so, that needs to happen. But by solely focusing on the tumor, we lose sight of the potential collateral damage that's associated with these treatments. I mean, full dose or maximum tolerated chemotherapy, radiation, surgery, all of these in context can be very destructive to the tumor, but they are equally destructive to the rest of the body. And so what we want to do is not sacrifice the healing of the body by destroying the body en route to trying to destroy the tumor. Again, the concept of destruction to heal doesn't really make a lot of sense. And in fact, if you destroy the immune system, you are setting up the process of recurrence and metastasis. So by working with the body, and the perfect example here is working with the immune system. Work with the immune system, you get the immune system actually doing its job. The immune system's job is designed to protect the body against all enemies. Enemies that are foreign, so infectious, or enemies that are domestic. Here, in this case, cancer is a perfect example. So get the immune system doing its job. That's the way we can tie into that process of healing and restoring anew. The next level of integration, and this always surprised so many people, is we want to integrate the evidence into what we do. So many people are unaware of the concept of integrative cancer care or integrative medicine as a whole, or integrative oncology, but they're also completely unaware of the science, and physicians are not excluded here. There was a 2001 Institute of Medicine review article that actually looked at where physicians were reading on the level of where current science was published, and they found that physicians were actually practicing at a level that was approximately 17 years behind the science. So if physicians aren't reading, if physicians are practicing behind the current published science, how can they impart this knowledge to patients as it relates to working through the evidence? But actually being in the evidence, being in the science, really guides a physician to practice more integratively, to practice more holistically, surely in the context of etymology, which is the understanding of where these words come from, historically, what it means to be a physician, all these things, but in the concept of what it means to actually treat cancer and heal cancer, we have to look at the science. And again, when you're in the science, there is no more evidence than the focus on integrative cancer care. And in fact, I would tell you, when you look at vitamin C as it relates to cancer care, there's no one therapy that is more published on, nor more research than vitamin C in the treatment of cancer. Yet, it's the most misunderstood. So, and I've talked about that in other areas. Check out our webinars, check out our blogs that you'll find on our website. But it is such a misunderstood because so many physicians, the industry as a whole, is not in the context of the research. Simply being in the research, being in the published evidence will allow one to work more holistically. And in fact, I think it demands such. And then the last point here of integration is the integration of precision. Now, what am I talking about here? The concept of the past, which was a one-size-fits-all approach in the treatment of cancer, that's foreign. That's no longer what should apply today. The concept of integration here as it relates to cancer care today is about precision. It's about customization. It's no longer about a one-size-fits-all approach. This customization, this individualization, this precision, it's found through several different parameters: genomics, epigenomics, transcriptomics, proteomics, and metabolomics. This precision function, by working with the body through these collective, what are called omics, allows us to really integrate with the dynamics of the body, target the tumor, heal the body, restore the whole, renew. This is what it means to be an integrative practitioner working in integrative cancer care or in integrative oncology. It means being a physician that works to heal, to restore the whole. To learn more about what it means to follow an integrative cancer treatment plan, I encourage you to go to our website over at Brio-Medical.com, check out our blog post, go to our YouTube channel, check out our videos there. Our purpose, remember, as the word physician in Hebrew means is healer, but also the word doctor in Latin means teacher. Our goal, our job is not to just heal you, but it's to teach you, it's to educate, it's to empower you through the knowledge of what healing through an integrative cancer program actually looks like. I'm Dr. Nathan Goodyear, Medical Director at Brio-Medical here in Arizona.